All right, in regards to driving while, I guess, high, a lot of the bags that if you have a prescription for medical marijuana, a lot of the bags come with a sticker on them with the proposition, citing the proposition, and it clearly states, do not operate heavy machinery or drive. I mean, you're not going to take a bunch of morphine and then hop into your car, right? It's supposed to treat. It's not for recreational use. As for controlling the doses, if you're going to eat it, that's probably preferable, as everybody handles it differently. And dosing and type would be handled by a licensed physician. It shouldn't be left up to the patient themselves, as it is now. As for the negative effects of smoking, such as pulmonary infections and chronic bronchitis, all of which are avoided by consuming it through edibles or vaping it being medical cannabis. And different cannabinoids are released at different temperatures when vaped, so you can actually control what effects you get by controlling the temperature. And, well, knowing what you have, which would, again, be left up to a licensed physician. As for Congress and why they haven't changed it to a Schedule III drug, I will again quote Sanjay Gupta, MD, Chief Medical Correspondent for CNN. I mistakenly believe the Drug Enforcement Agency listed marijuana as a Schedule I substance out of sound scientific practice. They didn't have the science to support that. It doesn't have a high potential for abuse and is very useful. In fact, sometimes marijuana is the only thing that works. By definition, a Schedule I substance is something that it has a high potential for abuse, as in higher than all other substances, and it has no medical benefits whatsoever. We've clearly demonstrated that it has plenty of medical benefits, and there are, in fact, cases where it is the only thing that works. I could provide first-hand testimonial of people with gastroparesis, gastritis, Crohn's disease, wasting disease, who rely on it in order to, be able to eat, to not have to sit in the bathroom for 3 hours puking their guts out. And a lot of their other medications that they may have taken beforehand would have just exacerbated those symptoms and left them feeling worse than they would if they had just suffered through their illnesses. And again, I will quote Christopher Organ as explaining that the issue is not about laws, but sick patients. Legislators aren't healthcare professionals, and patients aren't criminals. Medical marijuana phobia is irrational. In conclusion, I believe medical cannabis has the potential to provide a
All right, well, thank you all very much.